after World War II to say that we could be better, that no matter where you lived in Canada, nobody should lose their home or their possessions because a loved one needs urgent hospital care. So we pooled our resources and created Medicare, the system that the flagship social program of the early to late 60s. It's always been a shared federal-provincial responsibility. Medicare's defense and actual expansion to include a national universal pharmaceutical program and a national long-term care program are worth fighting for. Canadians we've met from coast to coast, they get it. The response we get on the doorsteps is universally positive. And we plan to keep health care and the Harper retreat from our flagship social program in the news and put it up the political barometer to make sure it's an election issue next year. Together we can win this fight by talking with and listening to one another, and by holding all politicians accountable, and by defeating the Stephen Harper Conservatives in October 2015.
We have pesticide use that is unregulated. We have a fracking review panel that isn't looking at the issue of water quality and the impact on health. There's no one on that panel with expertise on that panel. These are some of the realities that will impact on our health care system already before we have the cuts of the health care accord. All these things are issues that need to be addressed. They will be addressed because we're going to have a provincial election in 2015, along with the federal election. So when we're trotting out our pamphlets on health care, we'll have to do it at 2 levels and hold political aspirants to their feet to the fire. We want you to clearly define where you stand, what you believe in, and what you will do with our beloved Medicare system.
What we need and what we have to demand is an expanded public health care system. Kathleen and Paul talked about continuing care. We need First Nations care. We need a national pharmacare plan. The Federation of Canadian Nurses and the Doctors for Medicare have put out a report that said that we could save $11 billion a year if we had a pharmacare plan in this country. But what's the government gone ahead and done? It's negotiated an agreement with Europe called CETA, the Comprehensive Economic and Trade Agreement, that is not only going to allow transnational corporations to sue governments of each other's countries for public water services, for certain public health care services, for maintaining standards that the corporations can show don't exist in their own country. But they've also told the brand name companies that they're going, or drug companies, that they're going to meet the European standard, which means it's going to take 2 years longer for the generics to get to market in Canada, which is going to cost about $1.5 billion a year to Canadian patients, to Canadian taxpayers. So not only are we closing off a future, potentially, of a national pharmacare program, but we're going to increase the price of drugs to Canadians. And this is an issue that's absolutely crucial to Canadians, and most of us don't even know that these cuts are coming. We have to say that when the election is finished and the Harper government has been sent away and we have a new government, that we are going to ensure to each other, promise to each other, and get promises from the governments that are formed, the government that is formed, that we are going to maintain Medicare forever. Stephen Harper is not going to be here forever, and when he goes, he's not taking our healthcare system with him. Thank you very much.